Hello, my name is Tricia Vaughn. I'm a registered dental hygienist and Burst Ambassador. I just wanted to jump on here, take a couple minutes and tell you about a sleep study. So some of you may or may not know you have two different options for a sleep study test. One, you can go to a center and have your sleep study performed in a sleep center facility. Or two, you can have a sleep study sent to your house. You and your doctor will choose which one is right for you. If you and your doctor choose to have a home study test, you will have a box sent to your house that looks like this. When you get your box, you're going to open up your box and there's going to be multiple things inside. One is going to be a nasal cannula. Two will be the monitor with a pulse ox feed. And you will also have a belt for the monitor, and they will also send you some tape as well too. When you get your monitor, the first thing you're going to do is try to adjust the belt so that it fits around you like so. This is going to go under your chest and you are going to clip into the monitor. You're going to take the other clip and clip it into the other side like so. There is a feed on the side to tighten it if you need to tighten or make any adjustments. You will also need to put your pulse ox feed onto your finger. I recommend at this point now taking the tape and making sure that the tape is going around your finger. This is to ensure that the pulse ox does not come off while you are sleeping. So make sure that that is on correctly and then tape. Your next step is making sure your nasal cannula is on correctly. There is a backwards way, so you make sure that it goes in your nose like so. It goes around your ears. There is a little lever under here to tighten this for your make it feel secure, but not too tight. You don't want it choking you. There is a spot for this to go into the top of the monitor. Once it is in, it tells you to take a couple breaths, and while you're taking a couple breaths, the monitor is registering whether if it's reading correctly. So you will have lights on the top of your monitor here, and when everything is green, you are ready to go. So this is how you will be at night. Your last step will be take some more tape, and this is where you want to tape the wires onto each side of your face, making sure that while you're sleeping that the nasal cannula stays in place. Now that your wires are secure on your finger and on your face, now you're ready to go to sleep. When you wake up in the morning, you will then notice there is a round green light. It may go off now that I turn this off, but there's a round green light right here. When all four of these are lit, that means that you have an accurate sleep study, and there's enough data on here for them to read the study for you. So now that you have all of your stuff, now you're ready to get started. Let me get all this stuff back off, and I'm going to explain to you why you would need a sleep study. When you have a home study sleep test, this is to check to see if you have any obstruction within your airway, such as sleep apnea, while you are sleeping. So at night, there may be reasons that you are not breathing correctly, and these go into health concerns and linked with other issues. Sleep apnea has been linked within heart issues, digestive issues, and now they're linking it also within dementia at this time as well too. So we as dental hygienists can actually do a great service to our patients by checking in their mouth and asking just a couple of questions just to see if they have any obstruction within their airway. As you know, we're the ones who look into their mouth way more than themselves, any physician, or anyone else of healthcare as well too. So different things you're looking for. So you are looking for like a low palate. When you're looking in the back of their throat, there's a very small airway space. The uvula may be enlarged. It may be enlarged so that it's wide or it's elongated. It also may have an erythemic appearance to it from drying out and having too much oxygen flowing within that from mouth breathing. With that being said, most sleep apnea patients are also grinders as well too. You're going to see the pattern on their anterior teeth. So if we think back to CPR, when we're doing CPR, we do a chin thrust, so that way that we open up the airway. Well, when we're doing this at night, we are also having problems with having an obstruction within our airway. So we're also doing our own chin thrust by bringing that lower jaw forward. And then when we get enough air, we bring the jaw back. And then we bring the jaw forward to get the air, and we bring the jaw back when we have enough air. So at night, people are basically in a class 3 occlusion, going to class 1, class 3, class 1, all night long. And while that's happening, they're wearing away those anterior teeth. So you'll see a lot of wear on those incisal edges. Another thing too, because it's linked with grinding, you're also going to see bilateral linea alba. You're going to see a scalloped tongue. So you're going to see things that also go in hand with grinding, but you're looking also for that airway space, seeing low palate, high tongue, and that small space in between there. You're going to ask questions to your patients. You're going to ask them things, or do you snore while you sleep? Have you ever been told that you stop breathing while you sleep? You're going to ask questions. How well do you sleep? Do you wake up through the night? Do you feel well rested when you wake up? Do you fall asleep easily during the day if you were to sit down and watch TV or when you're driving in a car? Or do you fall asleep while you're driving? Do you fall asleep when you're a passenger within the car? So you're trying to build some sort of data, information, trying to figure out their sleep pattern. If they are telling you they're not sleeping well, they're snoring, they're getting that elbow in the middle of the night to roll over because they're snoring on their back, you're seeing a small airway space, you're seeing that bilateral linea alba, you're seeing the scalloped tongue, you're seeing anterior wear. Talk with the patient. See if they've had a sleep study before. See what the results were. See if they've already been told that they needed to wear a CPAP, but they're just not wearing it. So check in with your patients. Recommend for them to talk to their physician. Recommend for a sleep study, because we can help prevent heart problems, digestive issues, and links with dementia just by taking a couple extra steps and taking a peek at our patients. So this is a great service that we can do. It only takes a couple of minutes, and we've actually within our office have saved lives, because stop breathing in the middle of the night, it's not good. So we want to make sure that we're taking care of our patients. Thanks again for listening. I appreciate it. Have a wonderful day. I'll talk with you guys later.